The educational use of self, a mentor's lived experience. Mentors are pivotal in nurse education. Student nurses rely on mentors to support their learning in the clinical workplace. It's not the kind of mentoring that can be done remotely by telephone or email. A mentor needs to be there with the student. They use their hands and voices. For example, they might help a student insert a catheter, take a student on a medicine round, teach a student how to bandage a leg ulcer, or how to give an injection. These aspects of mentoring can be considered in relation to corporeality, lived body. The body connects with the world, sensing and doing. Corporeality is one of 4 life-world existentials that help us to make sense of lived experience. The other 3 are temporality, lived time, spatiality, lived space, and relationality, lived relations. Temporality is lived time. It involves awareness of the passage of time and a sense of past, present and future. For example, mentors can often evoke past experience, particularly memories of being a student themselves. It helps them to work out the best way to work with a student and reminds them where their values come from. Spatiality is lived space. It's about the meaning of place and space, how it makes you feel, as well as how it might help or hinder your work. The concept of spatiality reveals contrasting mentoring experiences between hospital and community settings, for example. Relationality is lived relations. Mentors engage in a range of relationships that support their activity. Some colleagues can offer specialist knowledge to students. Mentors also rely on relationships for personal support. The presence of a student can affect the dynamics between a mentor and patients or colleagues. All these aspects of mentoring can be viewed through a relationality lens. Mentor and student need to build a trusting relationship to support a process of critical reflection for practice learning. Which is great if it all goes with a swing and the student develops as expected, but what if it doesn't? If a student fails a placement, a mentor might easily feel guilty. She has befriended the student, but knows deep down that she wouldn't trust the student to care for a loved one, such as her mum. This thought affirms the decision to fail a student who has not met the required competencies. Students can get emotional when they fail. The stakes are high for them. But mentors often can't shake off those nagging doubts. This is why mentors need support. Mentors need to be valued and supported by their employers, showing an interest in their work. They can be encouraged to explore their past and consider the implications of mentoring for them. They would benefit from a strong support network. Thank you for your attention.